you?
Hey, how's it going?
Not too bad. It's nice to be in Philly.
Nice, welcome to Philly. I love this city.
Oh,
It's an exciting time to be in Philly.
Absolutely. World Series, right?
Yeah, all our sports teams are doing well.
Sounds good. Now, are you ready for your 73 questions?
Let's get started. Welcome.
So, let's get started. What is your name?
My name is Jason Hahn.
And what's your specialty?
I'm a cardiothoracic surgery resident.
What year are you in training?
It's an 8-year program. That's 6-year clinical, 2-year research. I'm 6.5 years in.
Hey. And where did you go to undergrad?
I went to undergrad at Columbia.
And medical school?
At Penn.
Did you take any gap years before going to med school?
I took 1 year out. At the time, my advisor said, hey, your application seems like it could use a little more research. So I took a year of research.
Okay. It's a familiar saying for a lot of med school applicants.
Yeah, it helped me out.
Definitely. Now, what was your favorite part of medical school? I know it's been a little bit.
My favorite part of med school? Honestly, I think I enjoy the freedom and the flexibility of it. It's a lot of studying, but it gives you choices on how you want to do that, when you want to watch the lectures, when you want to prioritize, working out first versus having to study the materials later, that sort of thing. I think I miss the flexibility of that a lot during residency.
So, what specialty did you think you were going to go into on your first day of med school?
Yeah, I thought that I wanted to become a neurosurgeon when I was a kid. I took a lot of neuroscience classes and stuff. I was a neuroscience major. And then I went to med school and then I watched neurosurgery for the first time and it just did not do it for me. The pace wasn't there for me.
Was there anything exact that made you change your mind and say no?
Well, I still think that neurosurgery as a field is really fun and exciting. It's just that when I was in the OR, it didn't give me that feeling that I was looking for. And I kept trying to force myself to feel it. And then 5 hours would go by and I would kind of try to have to force myself to be excited. And that's kind of when I knew that maybe that wasn't the right path for me.
Never a good feeling.
No.
So,
yeah.
Kind of switching around, were there any specialties that on the first day out the gate you were like, not for me?
I think long rounding culture was just not for me. And then obviously you have to follow up on so many tasks and document so many things. I admire them for it. It just wasn't for me.
I understand that.
Do you mind if I make a cup of coffee for myself?
Sure, go for it.
Come on.
I know you're busy and all the surgeons need their caffeine.
Yeah.
Oh. Now, what first made you fall in love with cardiothoracic surgery?
The first time that I watched it, and I think this is how I still feel about it, but the first time I watched it, I was watching a very fine anastomosis between two small vessels. And I looked at it very carefully. And the next time I looked up at the clock, half an hour had gone by. And I thought, wow, if time can fly in the OR just like this for the rest of my life, then this is it. It's something so fine and pristine and fast about it that just kind of draws you in and time goes by so quickly. And it's really enjoyable.
That's when you know you found something you love, where time just flies, right?
Yeah, and I couldn't shake that feeling since, so.
It's good to hear. Oh, now there's a lot of people wanting to probably be a cardiothoracic surgeon.
Yeah.
Based on how many people have requested this.
Yeah.
So for those people, how long does your training take after med school? And I know you're in an integrated program, but there are some unintegrated paths as well.
Yeah, exactly. So there's many different ways to go into the field of CT surgery. Cardiac and thoracic are combined pathways and a specialty. I'm in an integrated path, meaning you can come out of med school declaring that you want to train in cardiothoracic surgery, and that's a pretty specific path that you embark on. If you're still kind of on the fence about exploring more, then you can always start out in general surgery, complete that entire training pathway, and then go into a fellowship, which is a dedicated 2 to 3 year experience in cardiothoracic surgery. So that's a traditional pathway versus an integrated pathway, which all of that is combined.
Gotcha. Now, did you ever consider getting more degrees like an MBA or an MPH at all?
Sometimes I think about it, and then I realize that that's just not my priority at this point. The job keeps you more than busy enough. The clinical aspects of it are the most rewarding aspects of it. So I think to myself, do I really want to, at this stage of my life, forego doing an operation or taking care of patients to take more coursework? And it's just a hard bargain.
Yeah. So, what would you say is the most unique part of your specialty?
I think the most unique part of it is that, and this is true for other areas too, but it really demands excellence from every member of your team. Like the kind of work that you do in the OR for cardiac surgery, like everyone is excited to be there. Everyone, I think, is drawn to the fact that it is intense and precise and like really requires perfection. And if you make even seemingly a small mistake, the consequences can be really, really, really awful. And that's a lot to carry on your shoulders every day in your work. But I think the flip side of that is that it draws in people who are inspired by that and motivated by that. So it's a really good feeling when the operation is flowing seamlessly and everybody is enjoying it as much as you are and dedicated to it as much as you are, right? You never have to feel like you're, trying to put your team together. The team is already excited by the aspect of doing cardiac surgery. It's a nice feeling.
Very well said. Now, kind of continuing on that path of almost selling the specialty.
Yeah.
I always give everyone a chance to sell their specialty like a car salesman. So why should someone choose cardiothoracic surgery?
I still feel this way. I think it's the best job in the world, right? How many jobs in the world give you an opportunity to meet somebody who really needs your help, and the thing that they need help with is living longer or being healthier, and then you have a very specialized, very sophisticated skill set where you can tell somebody, hey, I want to take you through this really scary operation. Like you get to go into a room and say, you're going to have open heart surgery, and open heart surgery is a serious thing, but we're going to get you through it. And we've gotten good at it to a point where we expect the chance of something going wrong to be less than 1%, right? Like that's a really cool feeling. And then you get to come home knowing that that was your day's job and the day has flown by, and then you get to do it over and over again. And there are so many aspects of it that are rewarding, right? You're helping somebody. It's also technically very creative and demanding, and you get to work with your hands. So every single day you're operating on somebody, it's like I imagine how a musician feels when they're playing their instrument, or like an athlete feels when they're playing a game of, a match of something. So like that's what you do every single day. You do it for 8 hours to 18 hours and it doesn't really make a difference. And like, it's such a good feeling that, I think everybody should consider this field.
Good to hear. Now, kind of playing devil's advocate now.
Yeah.
Why should you not do cardiothoracic surgery?
I think there's a million reasons why cardiothoracic surgery could be a really demanding choice, and you can't sugarcoat that. Like I said, the stress level is there, right? As a trainee, as a surgeon, you're trying to figure out, like, is this the kind of stress level that I want every single day of my life, right? Like one could say that there's always technically an emergency that's around the corner. So you think you're having a light day, and then lo and behold, you're going to be up all night doing an operation, right? So in some ways you have to really decide like who you are, and if the feeling of being in those types of situations is more rewarding to you in the long term and something that's sustainable for you, then I think it's really awesome. But if you think you can, practice a different aspect of medicine and find that reward, and you don't necessarily want to deal with some of the balance related challenges, then there's other pathways to do that.
Very well said. So now a fun question. Are there any stereotypes of your specialty?
Yeah, I think cardiac surgeons are kind of viewed as like the cowboys of the hospital. They rush into an emergency. They're full of adrenaline. There's a lot of like larger than life personalities. They're usually highly energetic, highly intense. Some people might even be quick to being frustrated, but I think that makeup is changing a lot in the field. And I think there's generational changes that are kind of showing through. I think the diversity aspect of the field is changing rapidly. We probably have as many female trainees who are interested in the field nowadays than as there are male trainees, and it wasn't nearly as close to that even 20 years ago. So the makeup is changing, leadership styles are changing, so therefore the stereotype of the field is going to be changing as well. So there's hope.
My next question was going to be, are they true? But I guess you answered that. They're changing.
Yeah.
So, well, moving straight along, this is one that I know as a medical student hold some weight.
Yeah.
So you work in an academic institution, you work with students. What is your go-to question to ask your med students or anyone training with you?
My go-to question for any med student, you said? Can you ask
like in the OR.
Yeah. Gosh, it's tough, right? I mean, people who are in the OR for cardiac surgery are either really into it and they're here to see it because they know that they want to be cardiac surgeons, or there are students who are seeing it for the first time because they're in med school and they want to explore like what open heart surgery is. And depending on that, there's just so much to explain to them that could otherwise be like very overwhelming. Mm-hmm. Like, I think you can't take for granted that people understand what it means to be on cardiopulmonary bypass. So there's this big machine in the corner and there's 5 to 6 liters of blood running through tubes that are laying across the patient's table. And you just have to make somebody or help somebody orient themselves in that and what's dangerous to touch and what's not dangerous to touch. That's the hardest thing I think about integrating yourself into a cardiac surgery OR in the beginning.
Yeah. So now, personally for you, what's the craziest thing you've ever been pimped on?
Pimped on?
Yeah.
So, I think cardiac surgery questions you can manage. Sometimes attendings like to ask you questions about like that obscure thing that they're interested in outside of cardiac surgery. So when I was a med student, this one cardiac surgeon who's sort of like a history person, like asked me one question during an entire case, and that was, what year Rome fell? And obviously that's a very complicated question, so I didn't know.
Right. Well, let's kind of go to 1,000-foot view now. What does an average day look like for you?
I'm still a trainee, so my average day, you wake up around 5:30. You go around on the ICU patients, and from 6 to 7, take care of some of the things that need to get done, like updating your attendings about what happened overnight, talking to ICU providers to make sure that they have the tools they need, or if there's any light procedures that they need out of the way. And then you go to the OR. And cardiac surgery cases, they are long, right? There's no quick cases in cardiac surgery. So you go in there, a coronary artery bypass operation, which is one of our most common things, will run you somewhere between 3 to 6 hours. Some of the more complex operations, like when you have to reconstruct somebody's aorta, and sometimes it's even more complicated because you have to go into a chest that's been operated on before. Those are redo operations. That can take 8 to 10 hours. So you won't be getting out of the OR until at the earliest noon, I think, and if not, if you got one of those big cases going on, then sometimes 4 or 5 p.m. And then there might be a second case to follow that. So depending on how the day goes, you typically get out, make sure that there's nothing that was missed during the day. You tuck that patient in. I like to make sure that when the patient's dropped off in the ICU, that they're not, having any acute complications. And that means waiting for the x-ray, making sure they're not bleeding and stuff like that. So you stick around for a couple hours and then you come home. And then sometimes you're on call, sometimes you're not. And you go back and do it the same thing the next day.
Well, it still looks like you got a smile on your face here.
Yeah.
You got to enjoy it a little bit.
Yeah.
Now, you got some quick fire questions kind of going on patient load and lifestyle of what you do. So how many patients do you see on an average day?
When I round on ICU patients, it's about 30 patients. They're really complicated, so it requires a lot of time to actually go through their data and talk to them or talk to their providers. operative schedule wise, I think a cardiac surgeon does somewhere between 0 to 3 cases in a day, maybe on rare days more. So that's sort of our operative load. Some specialties that do very brief procedures, I think sometimes you have to see 50 patients in clinic and then do 20 procedures in a day. One thing that's nice about cardiac surgery is that you get to focus on 1 to 2 patients in the OR all day. That's a really nice feeling.
So what's the most amount of patients you've ever seen in a day?
Sometimes you'll end up operating on 4 patients in the span of like 16 to 20 hours or maybe 24 hours. But it just depends on the day.
Yeah. What's the hardest procedure you've ever done?
I still think that the hardest thing that we do is coronary operations. And you guys might already know what that is. A coronary operation is when you have to take a vessel conduit, whether it be an arterial conduit or a venous conduit, and then sew from one side of the artery to the other to bypass the disease. And what's hard about it is that, the vessels are really small and sometimes diseased. So you have to wear, 3.5 times loops and also use very fine needles that are so fine that you have to constantly worry about whether you're breaking them or not. And then the stakes are so high, right? So maybe if you're doing something else and you mess it up, the consequence is that it just doesn't hold. In cardiac surgery, if you mess that up, the consequence is either the patient has active bleeding or they have a heart attack. Or maybe you get off an operation and they've had a stroke because there's calcium bits that are floating around, right? So I think the stakes with every single graft that we do is what makes that so hard. Yeah.
Now, flip it around. What's the most common procedure you do? Kind of the bread and butter.
Yeah, honestly, still the bread and butter operation in this country for cardiac surgeons is coronary artery bypass grafting or CABG. A lot of stuff that we do is also valvular surgery. So obviously, people have aortic valve issues, mitral valve issues, whether they're narrowed or whether they're leaky. If that becomes symptomatic, that's something that we replace. And you can either, put in artificial valves or do some repair techniques for the valves so that it kind of keeps their native qualities. But those are really the bulk of the stuff that we do, this is probably too much information, but in recent years, there's been more wire and catheter techniques to address these, operations. So we work with our interventional cardiology colleagues. The field has become very much of an interdisciplinary, discussion. So the number of cases that we perform now has become really diverse. Yeah.
Gotcha. Now, what is the most memorable case you've had so far?
That's a tough question. So many memorable cases happen on a week by week basis. But a positive, memorable experience, I think, is always a heart transplant. Because you take somebody to an operation because they have end-stage failure, right? So that they don't have that much longer to live. And the whole complexity of finding a donor, going out to a different site, harvesting that organ, bringing it back, and then, sewing it into somebody's body, and then that heart functioning very normally, hopefully, when they, come out of an operation is the first time you see it, I think it's going to be a very remarkable experience. Because that that was the issue that was going to limit their lifespan, and a heart transplant can last on average 11 to 13 years. So when you wake up that patient after an operation and you see them walking around for the first time, in the time that you know them, it's extremely memorable.
Awesome.
Yeah.
Now, what is the toughest part of your job, in your opinion?
I think the toughest part is the unpredictability, and part of it might be because, as a resident, it's even more difficult to have predictable schedules. But, sometimes you want to make a dinner reservation at 8 p.m. and you think that you're going to be able to make that. And then something happens and you're like, ugh, well, I'm going to have to cancel that reservation. So the fear of something always getting in the way of scheduling something is the most challenging thing about maintaining a normal lifestyle.
Let's go on a more positive note. What's the most rewarding part of your job? And I know you've said a ton of them, but if you had to pick one.
Yeah, I think my favorite moment and the most rewarding moment is talking to the patient before their operation, because there's not a single patient who's not terrified of having open heart surgery, right? So almost always they're full of fear, and then you get to give them the sense of reassurance before they go into the OR. And I still enjoy that conversation a lot before you put them to sleep, because you know that that fear is something that is paralyzing for a lot of patients, but then you can actually offer them something that's going to help them in this situation. So I think it's one of those instances where you see the extremes of like human nature and encounters. Like cardiac surgery is going to expose you to the extremes of so many emotions: fear, reward. You know, you're going to worry like you've never worried before. You're going to feel happy like you've never felt happy before. You know, so I like that aspect of it.
Alrighty. Well, let's kind of move on to more lifestyle stuff. So,
okay.
How many hours do you work in an average week?
I would say that on an average week, I'm probably working 65 to 75 hours.
Yeah. What time do you normally wake up?
I wake up 5 or 5:30.
What time do you normally leave the hospital?
I leave the hospital sometime between 6 p.m. and 6 a.m.
How many hours of sleep are you typically working on?
Well, I typically sleep about 5.5 hours. And for some reason, even on a weekend, I can't sleep any more than that nowadays.
Body's just trained for it.
Yeah, I think my body's just kind of gotten used to it. You know, like I'll show you the rest of the house. Like I think sleep hygiene is such an important thing when you're a surgical resident. You want to make sure that you're well rested for the next day's work. I think you get used to it. 5.5 hours, 6 hours, and you can function.
How many hours of sleep are you working on right now?
Last night I stayed up a little late watching the Phillies game because we're in the World Series. Once in a lifetime thing, right? So 6 hours.
Okay. And you mentioned it earlier, but do you have to take call?
Yeah, we sometimes we take in-house call, sometimes we take home call. But typically you're on call, you know, anywhere between every third night to every fifth night. Yeah, and that's pretty consistent whether you're a trainee or whether you're an attending surgeon.
Gotcha.
Yeah.
Do you prefer days or nights?
You mean working?
Yes.
I think the normal answer is I prefer days, but there are some times where it's kind of nice to just work in a nighttime setting at the hospital. You know, things are quieter. You get to pay attention to more things that you missed during like the loud hustle and bustle of the day. So
how long does it take for you to finish up your notes at the end of the day?
Honestly, note taking is a very brief aspect of our careers, especially as you become more senior. I spend about 20 minutes writing a note a day, which is a really big plus, I think, in this specialty.
That is not bad at all.
Yeah.
Because you got med students writing your notes, right?
Drafting.
Yeah, that's right. Now, a wholesome question.
Yeah.
Who are you most thankful for on your care team?
Yeah, you're totally right. I think more than anybody, I'm most thankful to bedside nurses, and I think you don't get that perspective until you've spent a lot of time in the ICU and on the floors as a resident. The hardest part of taking care of patients are not sometimes, you know, the fanciest parts. Like the people who, like, you know, sit at the bedside and hold patients' hands for half an hour because they're delirious, like that kind of work is very demanding and thankless, right? Like your surgeon isn't necessarily going to know that you had to clean up this patient 6 times overnight, right? But I've spent a lot of time in the ICU now, and I've seen that at the bedside, and I'm most thankful for that aspect of patient care.
Yeah. Now, what's the funniest thing you've heard in the OR?
So this one surgeon that I like to work with, brilliant. He always used to say that there are 3 surgeons in the world alive who can do this operation, and I'm 2 of them.
That's the most stereotypical cardiothoracic surgery.
It is a very CT surgical comment to say, yeah.
All right. Then what's the most common medical advice you give to your patients?
The most common advice that I give to my patients are the hardest ones to follow, you know? Like people all know, I think in this country, what heart disease is and what are not healthy for your heart. But it just bears repeating, you know?
Yeah.
Exercise, the smoking, the diet, etc. It's the simplest advice to give, but the hardest to follow.
I'm sure.
Yeah.
And I'm hearing a couple voices down the hall. What's going on down there?
So come on, I'll show you what's going on here. So, you know, we've been working on this project for a little bit called The Modern Surgeon, and I'll show you what our setup is and then explain a little more about what it is, okay?
Sure.
Let me knock on the door and then... Hey guys, can we bother you for a second? Oh, I see we moved on to the patch exercise. Hey.
Who do you think is winning?
I'm curious. I'm just trying to look at Will's face, trying to figure out who the winner is right now. All right, well.
So what's going on here?
Yeah, so this is a semi-studio and a future baby room in our house.
Is there any tape?
So it's called The Modern Surgeon. You know, we started recording these videos together starting about 9 months ago. And I think the really brief explanation of this, in my opinion, is that the world of surgery is like so artistic and cool and rewarding and, you know, whatever that drew us to this field in the first place. But so much of it is at the same time kind of opaque and insulated, right? Like the people don't get to really understand like what surgical maneuvers are or how much thought or consideration goes into surgical technique. Like we want to make that more accessible because I think if more people understood just how cool it is, then more people would want to become surgeons.
I very much agree. And you've obviously managed to find a way to merge your medical career with a budding creative field on social media by highlighting surgery as more of a modern art form.
Yeah.
So what was really your big inspiration for creating such a platform?
You know, I think at some point I realized that some of the things that we were having conversations about as needs in surgical training and delivering surgery were also the things that were least covered, you know, online or in academic journals. And we just wanted to create something where the ideas would be, you know, more freely flowing. So whether it be surgical techniques, so we have a lot of stuff here, right? I mean, a lot of this stuff is highly technical, or whether it be cultural things that kind of describe surgery as a unique phenomenon. We wanted to highlight all of it. And we wanted to do it in a way that was sleek and modern and accessible, uses technology, uses multimedia, social media, the way that we talk about anything else in our lives. But maybe we don't do often enough in surgery. So that's why we started.
Very well said. So now it's all about questions about your life outside of the hospital. So
yeah.
Want to go back downstairs?
Yeah, let's make this one private. All right, we'll come back in a bit. All right. So that's our upstairs and the Modern Surgeon Studio.
And they seem like they got a lot going up.
It's a super fun crew. And honestly, the best part of it is that there's an attending surgeon in there. There's a med student in there. There's a non-medical person in there. There's my wife in there who's a surgical resident. Like, so what other way to spend a Saturday other than talking about ideas like this, right?
Absolutely. All the above. So, of course, this is, oddly enough, a day off, kind of, for you.
Yeah.
So what is your favorite thing to do when you're not working?
Yeah, let me pour myself a cup of coffee as I answer that question. I think more and more I look for hobbies that are just kind of calming. I like tending to plants. It's sort of become like a thing where every time I have a tough shift or something, I'll go to a plant store and maybe buy another one. So you can see that around the house there's a lot of plants. You know, it's kind of a weird thing, but sometimes I feel like it reminds me of rounding on plants. I know it's like kind of nerdy, but I mean, every day, like I go to I look at a plant, and if that plant is struggling, you have to decide whether you're giving it too much water or too little water, right? I mean, sometimes that's what I do with patients. You know, do they need more volume or less volume? And depending on that, you tailor the therapy. I just think I like observing how they, react to certain situations.
Weren't you the one that said you didn't like rounding culture at the beginning of all this?
Yeah. But for some reason, I think when it comes to plants,
make the exception.
Yeah, it's quicker.
Yeah. Okay. You mentioned it briefly, but do you have a significant other or any kids?
Yeah. So my wife and I, we've been friends since med school, which at this point is 6 years ago, and then we got married just less than a year ago, and then we do have a baby boy on the way, which is why the space upstairs is half a studio and then rapidly becoming a baby room. So
congratulations! Try to keep the surgical instruments away from the new baby.
Yeah, I'm gonna do a very thorough search of the carpet for any needles and threads. Don't worry.
Absolutely. Does your family ever ask you for random medical advice?
Almost never. And
really?
Yeah, it's not my family that asks me any questions about medical advice. I have friends from college, though, who I haven't spoken to in like 8 years, and then they'll reach out to me and say, hey, I'm getting this orthopedic surgery procedure. What do you think? And I'm like, dude, I know nothing about orthopedic surgery. The more you get specialized, the more you feel like you can't answer questions related to other fields.
Yeah.
But I think from the outside world perspective, that's, they know that their friend's a doctor, not necessarily a specialist in something.
Yeah. What's the weirdest question a friend or family has ever asked you?
I've gotten questions on what the best method for vasectomies and stuff, very GU procedures that I have no knowledge about whatsoever from friends. And then I usually deflect that one pretty quickly.
Yeah, understandable. Any pets?
No pets. My wife and I, I think we decided that with our lifestyle, pets are something that we can't keep up with. So my sister-in-law, for example, has 7 or 8 dogs at the farm. So we go there when we want to play with dogs.
Favorite animal, not a dog or cat?
Honestly, I think I'm more of a cat person than a dog person.
Okay.
Yeah. They're clean. They keep themselves clean.
Yeah. If you could have dinner with anyone in history, who would it be?
Gosh. Honestly, I don't think it would be a surgeon. I think if I wanted to have dinner with anybody in history, I would want to have it with someone who was an artist, who I think in my mind right now, I think that person would be Mark Rothko, somebody who just had a philosophy behind their craft. I think surgeons share that as well, but it doesn't shine through as often. I think I just want to have a conversation with somebody who's obsessed with something and thinking about the reason why they do it a certain way,
What would you guys be eating at that dinner?
I mean, I think if it were up to me, I'd be eating Korean food, but that's not going to be necessarily something that you can do everywhere.
Yeah. What's your favorite dish to eat?
I love broth-based dishes in Korean culture. A lot of the food that we eat is soup with noodles, soup with dumplings, soup with rice cakes, and etc. It just makes me feel whole and healthy,
I understand that.
So I still miss it. Yeah.
No. Coffee, tea, or soda?
I think each of those things has a very different purpose for me. I'm not a coffee person. I end up drinking a lot of it because of the lifestyle. I prefer tea because it gets me less jittery. And I drink soda when I'm bored.
Good reasonings for all.
Yeah.
Fun question, because every doctor gives me a different answer.
Yeah.
How much water should you be drinking every day?
Honestly, the way that I think about that question is you should be drinking enough water that, that your body will, continue to make urine at a rate that's healthy for you. That's kind of how I look at it. I drink water when I wake up in the morning until I feel like I have to go to the bathroom, because your kidneys are doing their job, and I just want to flush everything out.
Yeah. Oh, favorite meal from the hospital cafeteria if you have one?
That's one of my gripes about hospitals, um, especially when you work in the field of cardiac surgery. Like, I really wish that they had healthier options. My favorite option in a hospital cafeteria is probably chicken fingers at like 3 in the morning.
I hear that. No, pineapple on pizza, yes or no?
Oh, absolutely not. Yeah.
Any artistic hobbies you keep up with?
I don't know if you can call it art. I like Legos.
That is art.
Yeah. I mean, so if you take a look around the house, I mean, there's an open set right here, which I think I will tackle starting this weekend. They're micro Legos. So like I like to tell myself that even when I'm, I don't know, procrastinating with my artistic hobbies, I'm still kind of like working with my hands. Obviously with the baby on the way, I think I'm not going to be having any pieces laying around much longer. But if you look at this one, like I like architectural pieces. So that one took like a month and a half. That's 8,000 pieces, even though it doesn't look like it. And then I have the Eiffel Tower and the Opera House. And
All beautiful.
There's many more, but there's only limited space for Legos in the house. Yeah.
Right. Kind of moving along with art, what's your favorite kind of music to listen to in the OR?
More and more, I think it's classical. And I say that because operating for me, like, helps you be in the zone, like in that flow state. And I think my mind is always running around with so many different phone calls and questions and projects that in the OR, I like to feel like I'm just absorbed in that procedural aspect. And just simple classical music is that feeling.
Gotcha. Top 3 music artists for you?
I think I'm always going to be drawn to Bach because like that clean pace, it's almost like mathematical in composition, is so like peaceful. I love the Hamilton soundtrack. I'm a big Broadway person. I used to be in an a cappella group when I was in college, and I was in New York, right? So like that was a big part of my life. So I listen to soundtracks from Broadway shows, even if I may not be able to afford all the tickets. And then lastly, I really like sad indie music. I don't like loud booming music around the house because I feel like I can't relax. So really chill indie music is the last genre that I go to.
So one random task you wish you could be good at or better at?
I wish I could draw. Like I always thought that like operating on someone's body and then putting together nice incisions and nice suture lines required an aesthetic capability. And so when I was growing up, I was like, well, I may not be the best aesthetic person because I can't draw anything. Now, having said that, I think surgery is a different art form, and now I realize that, but I still wish I could draw something in a way that I'm proud of.
So what's the best way that you relax after a long day?
Yeah, honestly, I relax by, watching TV and working on Legos or working on puzzles. It's like something, like just a few nights ago, after a long day at work, like we put together this puzzle. This was a gift to me and my wife from our in-laws. It's a photo that was taken in Puerto Rico, and they turned it into a puzzle. Like some members of the family, we just sat here and then worked on a puzzle and then listened to nice music in the background, and we chatted for a couple hours. It's like having a dinner conversation, except there's something occupying your mind at the same time, So it's nice.
Absolutely.
Yeah.
So night in or go out on the town kind of person?
Increasingly so, night in kind of person.
Indoors or outdoors?
I like the outdoors, but not all types of outdoors.
Beach or mountains?
My wife is from Puerto Rico, so we end up going to a lot of beaches, but I think I'm still a mountain person.
Would you consider yourself more of an introvert or extrovert?
I think I was really extroverted when I was growing up, but more and more I'm becoming an introvert. Like my hobbies, as you can see, are very introverted.
And would you say that was a factor in you choosing your specialty?
I think it could be. I mean, I give credit to people who see 30 to 40 patients in an outpatient clinic every single day. That requires giving so much of yourself and energy to take care of patients. You know, I used to be exhausted after a day on my family medicine rotation where I was seeing patients, every 20 minutes and then saying things that are helpful or motivational in nature. That's really tiring. So maybe I think from that angle, I'm a little bit introverted in my field.
Yeah. So we're getting close to the end.
Okay.
Last wrap-up questions, but they are more reflective questions.
Yeah.
So let's have a seat for this.
Okay.
We're going to dive deep. I know there's a lot of people that want to be in your shoes one day.
Yeah.
So first question. What did you think you were going to be when you grew up as a kid?
Yeah. When I was really young, I thought I wanted to be working in a company. My dad worked for a company. I just sort of thought that that's what people do. And then when I was growing up a little bit further, I started getting interested in medicine. And this is kind of odd, but I'm Korean, and Korea was affected by a war about 60, 70 years ago now. And when I was growing up, my grandparents and my parents just thought that being in the field of medicine offered stability. When they were fleeing from the war, one of the relatives in the family was a doctor, and he was able to provide for so many people that were in need that I think when I was growing up, I just heard a lot of that going on around me. So I started checking out what this pre-med thing was. I'm happy I did.
Is there a different specialty you think you could have done?
Yeah, and I think I always tell people that if I didn't become a cardiac surgeon, I think I'd be a psychiatrist. And oftentimes when people give you advice about choosing your specialty, they say the first decision is medicine versus surgery, right? Like, are you going to be that person versus another? I don't necessarily view it that way. Like, one of the most rewarding aspects of being a surgeon for me is that, there's a craft, but at the same time, you're interacting with people in their most dire circumstances. Like I said earlier, like you see people in all sorts of different emotional states depending on what kind of disease process they're dealing with. Like, in many ways, I think of psychiatry as being a craft because you have to understand somebody's pathology and then help them get to where they want to be in a very systematic way. Yeah. So I always thought that was interesting.
If you didn't do medicine or surgery, what do you think you'd be doing right now?
I think I would be probably like a social psychology professor or an academic of some sort. Like, cool. so many of the books that I like to read are about like cognitive biases and experiments that people did that reveal something about how humans think and behave. So like clearly I enjoy that aspect of my job, but I think if I didn't do surgery or medicine, I would probably have pursued that academically.
Oh. Were there any times you doubted you would make it as a doctor?
I think cardiac surgery training makes you doubt every single day whether you have what it takes. And the longer I've been in this field, the more I think that that's not the right question to ask yourself. Like, whether you can do it and can get better, that's a question that should sit with you every single day of your career. Like, I don't think it's something that you ever fully overcome. And asking yourself that every single day and being able to be comfortable with it and growing from it is, I think, a hallmark of a good surgeon. So, I ask myself every single day, like, why can't I throw a better stitch? Like, why could I have not avoided that complication? Does this mean that, like, I'm just not cut out to be a surgeon? Like, are my hands not good enough? But, that's just part of training. That's just part of becoming a surgeon.
If you could change one thing about the medical field right now, what would it be?
I think there needs to be more communication in the field of medicine, and not just among ourselves, but with the world. Topics are so complex. Some of the technology that we're dealing with in cardiac surgery is almost sci-fi, right? We put people on artificial machines that, pump on behalf of your heart. we have devices for virtually every single problem that you can run into. You know, do our patients really understand the complexity of that? You know, like, do we understand what our patients are feeling or what they need? There's just not enough of that conversation. I mean, part of the reason why we started the Modern Surgeon is so that people can look at it from the outside world and say, wow, like, that's part of surgery? I had no idea. Like, right now it's probably a black box for them where they're sort of like, well, I go to sleep and I wake up and hopefully I'm okay. Mm-hmm. But maybe if we demystify it more and more through intentional efforts at communicating them, then this would be less intimidating and more interesting.
Yeah. All right. So what can a medical student do right now to prepare to go into your specialty?
I think med students interested in surgery, like, you have to spend time on surgical rotations. You have to figure out who you are when you're living that lifestyle. Because there's a difference between loving the image of something and loving the reality of something, right? And sure, like, I may have grown up saying, oh, I love the idea of being a neurosurgeon. But when I walked into the OR, I was like, man, I really don't like the reality of being a neurosurgeon. Similarly, I never thought, wow, I think I'm a cardiac surgery kind of person. But then I was in the OR and then I realized that that's what made time fly by, right? So you just have to put yourself in situations and be really honest about who you are. And I think that's just a part of self-awareness that you develop in medicine, you know? And don't fool yourself into a long list of pros and cons on why you want to go into this specialty. Ask yourself, are you happy in this moment? Mm-hmm. Like, is this day-to-day job making you the person that you want to be? And for surgery, that's just exposure. Yep. You know, putting yourself in those situations. Right. And also, I think practicing is important. And most students assume that you'll learn how to do something in surgery when you're in that position. Like, you'll learn to close skin when you're in the OR, or you'll learn to do something in the OR for the first time when you encounter that problem. But I don't believe that. I think anything else that we do in life where you want to become good at something, like, you create drills, right? And then you work on that skill before you play it professionally. Like, anything else that I can think of, like, before you perform a concerto for the first time, I'm sure you're practicing it a lot. So that's how I feel about surgery. Sure. And I think it's actually an ethical responsibility. So, you know, get to know your instruments. Try tying at home, sewing at home, look for resources. And yeah, maybe it's not the real body, but that's how you should learn in the first place.
Yeah. Now, last two questions.
Yeah.
Ready?
I'm ready.
If you were to go back, would you change any of your experiences that got you to where you are right now?
I think if I were to go back to before starting residency, and this is like one of those things where I think every person feels this way, and you can't go back, and that's why you feel nostalgic about it. I wish that I paid more attention to experiences with family and friends that you can't take for granted for the rest of your life. You know, I think going into medicine, especially a demanding surgical specialty, sometimes you only think about work for a long period of time. It's kind of like you disappear for months at a time, because that's what being on a busy rotation is, or being in residency is. And I wish I started being more intentional about that kind of stuff earlier on, because you have to be intentional. You have to be so intentional to the point that, like, you leave yourself little reminders to call that person, or like to ask them how they're doing, you know, because otherwise you're so tired that you don't get a chance to get around to it. But I mean, at the end of the day, that's what life is, right? And you have to remember to live life even as you're entering your job and loving it. You know, so
agree.
That's how I feel.
And finally, question 73. What would you say to the aspiring cardiothoracic surgeon right now?
I would say that this is the best job in the world. And there are probably very few people who can honestly feel that way for their whole lives. And despite the fact that residency is so grueling and challenging in so many different ways, the fact that I still feel this way after 6.5 years of it is is something that I want to share with the world, and a lot of people who are interested in this field, you get to feel that way, you know? You might hear a lot of things that make you a little nervous about the field of cardiac surgery. You might say, do I want to make those sacrifices? Do I want to be in situations where the stereotype of the field is maybe a little more toxic than what you'd be willing to put up with? But you get to define that as you enter the field. And that was an important realization for me, you know? Like, a stereotype of the field is not just something that you have to deal with, it's something that you define as you go into it and become a part of it. So, I don't know. That's what I want to tell a whole bunch of students coming up interested in this field. Give it a chance, and then whatever you're nervous about, be that change in that field, you know? Because I think we could use a lot of good people in our field.
So well said. Thank you so much for your time. This is incredible, and I know there's plenty of future cardiothoracic surgeons holding on to every word, man.
Yeah, I appreciate it. Thanks for being here.